Hey everybody, it's me again, Brian Evans here at Sierra Nevada. I just wanted to touch base real quick about a couple things. Thanks for everybody's questions and responses to the videos that we put on Facebook. Really appreciate it. One thing that's been coming up a lot from folks is it safe to come into the emergency department or to come into the hospital? I know that there's some folks out there who have been avoiding the hospital even if there are some things going on that they need to have looked at or addressed. So the short answer is yes, it's safe to come into the hospital. Certainly if somebody has an emergency condition, they should do that. They should come in, especially if they're really feeling not good, if they're having chest pain or shortness of breath or something like that that's concerning. By all means, we are open. The emergency department is open. Our ambulances are running in the community and they're available to take care of you. But I wanted to go into a little bit more detail on exactly some of the things that we're doing to help keep folks safe when they come in as a visitor or if they're coming in as an emergency patient to the hospital. And so for that, I'm actually going to kick it over to my colleague Liz, who is one of our security officers here, and she's been helping a lot with the screening procedures and just making sure people are headed in the right direction when they come into the emergency room. So with that, I'll kick it over to you, Liz.
Hi, I'm Liz. I'm a security officer at Sierra Nevada Memorial Hospital. I thought that today I would just kind of give you a brief understanding of what we do when you show up to the emergency room as far as screening and making you feel safe. The first thing you'll do is see an officer or screener meet you out front. We're going to ask you a list of questions and just kind of get a general idea of what's going on. The first thing we'll do is greet you and ask what your chief complaint is. We'll check to see if you have a fever, shortness of breath, chest congestion, maybe a sore throat, or flu symptoms. Once we've determined that you don't have any symptoms that we're concerned about, possibly COVID, from there we'll go ahead and offer you a mask if you don't have one and check you into the emergency room. Now if you do have something that might be a concern, like a fever, cough, chest congestion, shortness of breath, we'll have you wait outside and we'll go ahead and seek an emergency room nurse or the charge nurse, give them the information, and from there we'll kind of make a good decision on how we're going to bring you in the hospital and get you tested. If you have any of those symptoms, we have an area in the back of the hospital where we do rapid COVID testing. In that area, we go ahead and continue the process of doing a swab, and then we wait and get the results. During this time, there is no contact with the patient and the rest of the patients in the hospital. It's a private area in the back of the ER, and we're seeing other regular patients on a normal basis. So if you have an emergency, please do come see us. We're still seeing regular patients. Johnny breaks his arm, we definitely want you to come in. So hopefully this answers some questions, and take care and stay healthy.